Hi, I'm Dr. Kyle Ballou. Thank you for watching this video. Ever since I did my residency down at San Antonio at the University of Texas Health Science Center at San Antonio, I've been passionate about diabetic foot care. So many people have diabetes and are affected by diabetes. I just wanted to take a few minutes to tell you a few of the concerns that I have with the general population and diabetes. I see a lot of people who have diabetes, and I treat a lot of different ailments that are caused by diabetes. I'd like to enlighten you a little bit as to what can happen. First of all, as we know, diabetes is a controllable but not a curable disease. We know that diabetes affects small vessels, therefore affecting the feet and toes, among other things in the body, significantly. We know that the longer a person has had diabetes and the longer that it's gone uncontrolled, the more apt you are to have problems that are secondary to the diabetes, such as the feet problems we have, or eye problems, or kidney problems, and there are others. Diabetes affects several systems, but in the feet, I want to talk to you mostly about two systems that are affected. One is the neurological system, which controls the feeling in your feet, and the other is the vascular system, which controls the circulation to your feet. Let's first talk about the circulation. As I said, diabetes is a small vessel disease, and the feet have all small vessels in them, and they get smaller as they go toward the toes. So these are the ones that are really affected by diabetes. It generally makes the circulation get less, the arteries become more narrowed, and the blood supply to the tissues is diminished. Therefore, the oxygen to these tissues is also diminished. The neurological system, or the system of feeling, gets affected in several different ways. There are 6 different distal polyneuropathies that are associated with diabetes. However, let's talk about the 2 that I find are the most prevalent. One is hypersensitivity, where you feel everything even more so than most people would. A lot of times at night when you lay in bed, your mind will be relaxed a bit, the day is over, and you'll concentrate more on the sensations that are coming from your feet. You may have sharp shooting types of pains or numbness pain. They may just ache. They may feel cold or they may feel hot. All of this is secondary to diabetes, and it's called neuropathy. I'm not so worried about this type of neuropathy because that tells me that you can feel things in your feet. So if there were a problem such as a little wrinkle in your sock or a small pebble in your shoe, you'd probably feel that and sit down and take it off, and your shoe off, and take out the pebble or straighten your sock. But then the other type of neuropathy that I see a lot is the hyposensitivity neuropathy. That's where you don't have good feeling. Sure, if I hit you over the foot with a sledgehammer, you'd feel that. But it's the smaller, finer feelings that you can't feel. For example, if there's a small pebble or the same wrinkle in your sock, you may walk on that all day without feeling it. Doesn't mean you can't feel some things in your feet, but it means that you can't feel those things. And it's those small areas that you can't feel that can cause the trouble. If you had a little small pebble in your shoe and you walked on it all day long, well, it would put pressure on the skin, causing the circulation to the area not be very much, and therefore you could have that piece of skin die and it would slough off, and that's an ulcer. I like to describe this to my patients in the office by showing my thumbnail, and it's pink, but if I put pressure on the nail plate, the nail bed underneath blanches and it turns white. Well, now that doesn't hurt me right now, but if I held that for about 2 hours, it would burn like fire. And I would have to let go as soon as I could to allow the blood flow to get back there, which would relieve the pain. The same thing happens in a shoe. Maybe you've got a little hammer toe on your small toe or a bunion, some bony prominent area that the shoe is applying pressure to, or maybe it's that same wrinkle in the sock or the pebble in the shoe. Either way, low-grade, sustained pressure on these areas can go undetected all day long, And when they do, because of the lack of blood flow to those areas, they will slough and cause an ulcer. The skin will die and fall off. I've seen this go all the way down to bone. People don't realize when it's happening. They come to see me and say, I don't know, doctor, I just took my shoe and sock off and the blood flowed out. I don't know what happened. I didn't remember anything happening to it. And that's because they have hyposensitivity neuropathy. Now, once you have that sore on your foot because of this low-grade sustained pressure that you never felt, we now have to decide, do you have enough blood flow? Has the diabetes affected the blood flow yet? And if the answer is no, that you have great blood flow, then the chances that you can heal that area are much better, assuming all the other factors fall into line, such as your glucose levels, your nutrition levels, infection, debridements, local wound care, what ointments or solutions or products you're applying to it. Let's say that you don't have good blood flow to that area. We can't feel pulses. We send you for some vascular tests that are non-invasive. They come back and say that you don't have great blood flow. Well, until you get good blood flow, you won't heal that area, no matter how small it is. It takes more blood to an area to get something well than it does to keep something well once it's already healed. So we have to establish how much blood flow you have, and if there's not enough, we have to correct that and do some method to get more blood flow to this area so it will heal. It's very complex and very complicated, and to heal an ulceration, many factors must be working together and be done at the same time for this to heal. Once it gets into a situation where you have an ulceration, that's a medical emergency, and it is actually a limb-threatening situation. Not only can infections set in to cause you to lose a toe or part of a foot, you could also have bad circulation, or you could get septic, and it could become a life-threatening situation. So I would urge everyone, if they think they've got a problem of this nature, please don't wait. Get it checked out quickly. Now, I've left a lot of information out. I didn't want to run too long on this video, but I will tell you that there's many more factors involved with getting this well. Diabetes does most of the harm the longer you've had it and the longer it's gone uncontrolled. So please try to control your glucose levels. Try to eat well, exercise well, keep your weight down, keep your glucose levels under control, and by doing that, you can avoid many of these problems for your entire life. If you're not diabetic but you know someone that's diabetic, pass this information along to them. If you are diabetic, please take heed and try to find yourself a podiatrist that can check you out at least once a year for a foot exam, and if you have problems, you may need to go more than that. But my job is to try to get the information out to the public, and so if you know someone or you have a friend or a coworker that's diabetic, please tell them this information. Maybe they can tune into this video and watch it as well. There's much more to be learned about all of this that I did not have time to go into, but suffice it to say that it is an urgent situation. So please help me to pass this information along to others that you may know. Thank you for watching the video. If I can be of any assistance to you at any time, please don't hesitate to contact me. Thank you.